I have opened up the aorta, like I have sectioned this tube and open it up for you. So you can see that the three valves or the three flaps of the semilunar valves are opened up in front of you and you can see the shape. So what they're doing, they are making sure that because of their shape, they are like this, and they prevent the backflow of blood into the ventricles. So the same thing is happening on the right side. So what happens during the systole, the phase of ventricular emptying, the semilunar valves, they open up towards the vessel, right? So the openings of the AV valves and the semilunar valves are totally opposite from each other. AV valves are opening downward towards the ventricles, and the semilunar aortic and pulmonary valves are opening towards the vessels, away from the ventricles, because the blood has to get out. It has to be gushed out of the ventricular cavities, right? So once the blood has entered the vessels, the pressure within the vessels has been raised. As a result, there will be complete closure of these cup-shaped, semicircular, moon-shaped valves or flaps. They just approximate the anterior and the anterior and the two posterior valves. They get approximated, and then they completely obstruct. They completely close the exit of the ventricular cavities. Okay, that will prevent the blood from backflowing into the ventricular spaces. Okay. You just have to understand that the left ventricle and the right ventricle, they are like two rooms with two doors. Both these rooms are completely separated from each other via this musculomembranous septum, the interventricular septum, right? And there should be no mixing of deoxygenated and oxygenated blood together, okay? This diastole is the phase of ventricular filling, in which the entry doors, the AV valves, will open down towards the ventricular cavity and blood will rush towards the ventricles from the atria. While once the ventricles are filled, the filling has been completed, now the phase of ventricular emptying is started. That is the systole phase. In that, the exit doors or the semilunar valves will open up towards the vessel walls. Okay, and that's how the blood will gush out from right and from left ventricle. From the right ventricle, it will go to the pulmonary circuit. From the left ventricle, it will go to the aortic or the systemic circuit. Okay. Now, before moving on to the walls of the ventricle, I also want to mention that if you look at the arrangement of great vessels, I just have removed the anterior wall so that you can have a better look. So they are sitting on top of the interventricular septum. Okay, so you can see that the pulmonary trunk is slightly on the left to the aorta, while the pulmonary trunk is emerging from the right ventricle and the aorta is emerging from the left ventricle. But if I close the ventricular cavities and I ask you which vessel is emerging from which chamber, so you will feel that the aorta is emerging from the right ventricle while the pulmonary trunk is emerging from the left ventricle. This is not the case. When you open up the ventricular cavities, then you are able to appreciate that there is a spiraling twist. So the aorta is slightly twisted towards the right side of the heart, while the pulmonary trunk is slightly twisted towards the left. And that happens during the developmental phase, and it's a very, very important phase of development. And if it doesn't get completed in a normal way, there definitely will be some cardiac defects, birth defects. Okay, I'm not going to talk about those congenital birth defects right now. We will discuss those defects some other time in a detailed lecture. But right now, I just want you to understand that even without opening the heart, without looking at the interventricular septum, you should be able to appreciate that the aorta is emerging from the left side or from the left ventricle, although it is on the right. It appears to be emerging from the right, while the pulmonary trunk is emerging from the right ventricle, but it appears on the surface, it appears as if it's emerging from the left side. Okay? What about the wall or the musculature of the heart? And not the musculature, but in general, because heart is a hollow tube. And we did discuss, when we were talking about the blood vessels, I did talk about the walls of a tube. So there is an endothelium, that is the innermost lining. There is that is the tunica intima in the vessel. Then there is a tunica media, which is made out of smooth muscle fibers, so it's the muscular tunic. Then we have a tunica adventitia, which is made out of the coarse connective tissue fibers. Okay, so just keep that arrangement in your mind and then have a look at this drawing. Okay, imagine this is a section through the wall of the heart. So this is the cardiac cavity, or the inside of the heart cavity. So it's been lined by this inner flat squamous shaped cells. That glistening membrane, instead of calling it the endothelium, you call it the endocardium. Okay, it's the same lining, which is been known as the endothelium or tunica media or tunica intima in a vessel, and consider heart as a giant vessel. Okay, so the innermost lining of this vessel is known as the endocardium. Okay, all these flaps which we just have discussed, the semilunar valves and the tricuspid and bicuspid valves, the flaps of these valves have been formed, they are actually originating, or they are the extensions from the endocardium, or the innermost layer of the heart wall. Okay. Then this black colored zone is the middle layer. It's representing the myocardium, right? So the cardiac muscle layer is in the middle. That is equivalent to tunica media of any large vessel. All right. Then the outermost, this brown colored layer, that is the outermost layer. So we call it the epicardium. We could have also called it ectocardium, but it looks better when you call it sounds better when you call it epicardium. Endocardium is the innermost, and the epicardium is lying just under the serous pericardium or the visceral pericardium. Sometimes in some books it has been mentioned as the epicardium is a part of the serous or the visceral pericardium. Okay, it is inseparable. It is lining the outer surface of the heart. Okay, so the functional layer of the heart is myocardium, because that is responsible for these bands, spirally arranged bands of myocardium. They are responsible for the squeezing movement of the heart, and through which the heart is capable of pumping blood out of its cavities. Right. The other thing is one more structure we just have talked about, the chordae tendineae. The chordae tendineae are the extensions of cardiac muscle. They are specialized cardiac muscle. If you look at this drawing, this is the central tendon of the diaphragm we just have discussed, and the inferior vena cava. So imagine my palm is the central tendon of the diaphragm, which is fibrous tissue. Okay, it's not muscle. So every time when I'm breathing in, my diaphragm is going down, expanding the thoracic cavity vertically. Okay, it is expanding the thoracic cavity to accommodate maximum amount of air within the lungs, because the lungs are expanding vertically along with the thoracic cavity. So the domes of the diaphragm, which are fleshy, they are made out of skeletal muscle, they will go down, but not the central tendon. The central tendon is pretty much resilient. It is indestructible. And upon this central tendon, the right atrium is resting. Which part of the right atrium? that part where the inferior vena cava is opening, the floor of the right atrium is resting upon the central tendon of the diaphragm. So every time when I'm breathing in, this opening in the central tendon will slightly be stretched out. That will increase. So what is happening during the process during the act of breathing? My intrathoracic pressure is falling while my intra-abdominal pressure is rising, because the diaphragms are pushing, the domes of the diaphragm is getting flatter, and it is going to push the organs within the abdominal cavity. So that is going to increase the intra-abdominal pressure and expand the chest, right? So there is like a pressure mechanics involved. So due to the expansion of the opening of the inferior vena cava within the central tendon, the blood will be sucked in from the lower part of the, or from below the diaphragm. It will be sucked up, it will be sucked in towards the right atrium. Okay, so breathing or inspiration or inhalation is extremely important when we talk about the venous return. Okay, it improves the venous return. It's crucial for the venous return, because majority of the body is lying below the diaphragm, and we need this pressure mechanics to be acting, so that as a result of negative pressure within the chest cavity, the blood will be sucked in towards the right atrium. Okay, it is very important to understand before. So what we have discussed in this session, we did talk about the external features of the heart, all the grooves, all the surfaces, the borders. We also talked about the fibrous skeleton around which the bands of myocardial bundles are wrapped, right? Or the cardiac muscle bundles have been wrapped, and this fibrous skeleton, or the cardiac skeleton, is responsible for the support of these valves, the AV valves and the semilunar valves. Okay. Then we talked about the internal features. We discussed the interventricular septum, its structure. We discussed the atrial cavities, which structures are, or which veins are opening in the atrial cavities. We talked about the ventricular cavities, and one more thing. I didn't mention about the fact that the right ventricle, in most of the cases, the right ventricle has, like I talked about the Trabeculae carneae, or fleshy bars of myocardial tissue, which are actually creating these corrugations within the inner lining of the ventricles. So there is an existence of a free Trabeculae carneae, which is not anchored. It is like it is anchored between the anterior wall of the right ventricle and the right side of the interventricular septum. This specialized band of Trabeculae carneae is known as the moderator band. If it is present, it's present in all the animal hearts, but at times it is also present in human hearts. So it is always present on the right side, in the right ventricle, not on the left side. All right. The other thing is, it is playing an important role in the conducting of signals. So when I will be talking about the conducting system of heart, I will be mentioning the existence of moderator band. This is what you have to remember. Okay. So we talked about the great vessels, we talked about the valves, we talked about the positioning of the heart. So in the next session, I am going to talk about the blood supply to the heart, or blood supply of the heart. Why do we call that blood supply, or the set of vessels which are serving the heart itself, as coronary vessels? Because they are sitting, so this is the heart, it is placed like this in my chest cavity, and there is a groove between the atria and the ventricles, and we call it the AV groove. atrioventricular groove. So these set of arteries and the veins, they are occupying this groove, the AV groove. So they are actually sitting around, or they are wrapping around the heart like a crown. As if you place a crown on top of your head, it is like a crown. The set of vessels which are responsible for the blood supply to the heart itself is embracing the heart like a crown. Okay? Junction between the atria and the ventricles. So that's why we call them coronary vessels, driven from crown. Okay? Coronary vessels. So I'm going to talk about the coronary circulation, or the blood supply of the heart, in my next session, and I will also talk about the conducting system of the heart.